Sorry, I meant fight or flee reaction, or the idea is when you are about to meet with an accident. So that time your sympathetic nervous system starts where your blood pressure increases, your heart rate increases, your respiratory rate increases. But once that situation is over, then your parasympathetic takes over. And now your blood pressure, everything becomes normal. So sympathetic, I tell people, is like pushing your leg on a gas pedal. And the parasympathetic, when everything becomes normal, is pushing your foot on the brakes. This is fine for acute stress. But if this continues, every time you get this kind of a feeling and every time your sympathetic nervous system gets in overplay, this will lead to chronic stress. And chronic stress is what we are worried about. That will eventually lead to high levels of cortisol. Now you start eating more, you get more obesity, and then you start getting the sleep apnea. So it's a chain reaction. So stress should be handled in the number one thing in stress is you should be able to handle the stress. Now, that can be either a religion, spirituality, psychotherapy, yoga, meditation, sky breathing. All these can help you, or ultimately, if these don't, then medications. So, in effect, what you should be able to do is manage your blood pressure at home, regular checks, take these readings to your doctor, have a good social support, get a good night's rest, and that should take care of the situation. Complications, once blood pressure, you don't take the proper precautions or proper diet, and you don't follow the lifestyle changes, then you can get high blood pressure, can cause a heart attack, stroke, aneurysm. And because your now heart is pushing harder and harder and harder, it gets enlarged. So you get that left ventricle enlarged, so hypertrophic. Then you get a cardiomyopathy, which is very much enlarged, and now it's not functioning well. So you get a heart, your pumping action is slowed down now. Instead of this, it is very slow and not as forceful. And so you do get heart failure. And once that is there, then it becomes, if it is your ejection fraction goes very low, then it's heart transplant and what have you. It can cause kidney disease, it can cause eye problems, it can cause metabolic syndrome, because with your high blood pressure, if you've got a visceral obesity, abdominal obesity, with insulin resistance, with high blood sugar and cholesterol, now you're in a metabolic syndrome, which is, again, a problem. And then you can get vascular dementia, is what we say, that if your high blood pressure, hypertension can cause mini strokes. And these mini strokes means your blood is your pressure is causing this problem. And therefore you can get vascular dementia. And this, I've seen quite a lot of patients who have had this. Once they get this mini strokes, they cannot, their memory, short-term memory is gone. So be careful about this issue also. Let's talk a little bit about hypotension. Hypotension is is a condition that is overdiagnosed. If you have a low blood pressure, say 90 over 60, and you've got no symptoms like dizziness or feeling faint, it is absolutely normal. I had a female colleague in the 1970s, and she used to have a blood pressure of 90 over 60, and we were all worried. Oh, you got very low blood pressure, but she was doing fine. If your blood pressure is low due to severe dehydration or losing blood, then you are in a shock, acute loss of blood. Then you get confusion, cold, clammy skins, your rapid pulse rate, your respiratory rate, shallow breathing. So it is a situation, if you've got low blood pressure and you're doing fine, don't worry about it. Hypotension due to vasovagal response. This is because of a certain frightful event. Like I've seen quite a few patients in my practice who see the sight of blood or a sight of an injection needle, and boom, the blood pressure goes down, they're hypertensive. Not to worry at all. They come back to normal very soon. So, other important thing is postural hypertension, is the sudden drop of blood pressure when standing from a sitting or lying down position. This can be caused by dehydration, long-term bed rest, certain medical conditions, we'll not go into it, and medications, and mostly found in elderly. It is benign most of the times, get plenty of fluids, and get up slowly from lying down to sitting and then standing. And wear compression stockings, because what has happened is when you get up suddenly and stand up, your blood is pooled down in your abdomen and your legs. So do it slowly and wear the compression stockings that can push the blood back into the heart. Your heart should be able to get enough blood when you're standing up. And finally, if all the things fail and you've done everything within your means, then the doctors may prescribe medications after a period of time, if it's essential hypertension. Then they may ask you to take diuretics, which decrease the blood volume, so that helps, so that the heart has to do less work. They may give you calcium channel blockers, which again, it's a vasodilation, in which case your arteries dilate. And sometimes they use beta blockers if you had a heart attack, whereby your heart does not have to function that much. And having said that, this is the end. And if you have any questions, I'm doing this series of talks every month, health talks. And if you have any questions, please feel free to even ask about blood pressure in my next talk next month. Thank you very much for listening.